Earlier this week, I sat down with representatives from both sides of the State Question 793 campaign. State Question 793 is a constitutional amendment that would loosen restrictions placed on optometrists and opticians practicing in a retail setting. First, we will hear from Tim Tippit and Josh Harlow from the Vote Yes campaign as they present their case for supporting the measure. We will also hear from Dr. Selina McGee, an optometrist in the Oklahoma City metro area who opposes the state question. Tim, can you tell us a little bit just about the campaign and what you guys are hoping to accomplish for the state?
Let's start off with what 793 really is.
Sure.
793 improves accessibility for Oklahomans to get affordable eyewear by allowing optometrists to operate in retail stores. That can be a retail store like Walmart or Costco, or in a retail optical store like I have in Michigan and Ohio. It's not allowed under current law, one of only 3 states that doesn't allow it.
And the other 2 states are?
The other 2 states are Delaware and Rhode Island.
So nowhere around us. That's,
right.
That question got brought to me earlier.
Sure.
Everywhere in our region has eyeglass.
Right. So what some people will say, I think, is that, why does Oklahoma need this? Everything's just fine now. There are no issues, that sort of thing. And kind of what Tim was alluding to, and what I'll tell you is we're 1 of 3 states. And if you drive 25 miles from Miami to Joplin, or you choose any border community, you can go to a retail establishment in which has optometry in it. Tim alluded to price and affordability. We just released an affordability study in which Tim can get into, but 65% of cheap, more affordable glasses that you can get a lot of times at retail, establishments, including for children. Mm-hmm. And so there's a lot of issues, I think, and this is one of those things in which a lot of people say, which you hear a lot, David, about border communities, and are we losing the war to Texas or the economic war to Missouri or Kansas or whatever, and this is actually one in which we can prove with a lot of data that we are.
Okay. And what, again, in the retailer sense, for someone who's never left the state of Oklahoma, which there are folks,
Sure.
Those in the states surrounding us, they walk into a Walmart, usually in those front office sections, they'll have an optometrist or a setup operation, or a Costco or Sam's or retailers like that. That's kind of how they do that in some of these other places, correct?
That's exactly right. And if you came into one of my stores, it's strictly optometry. But either one of those are very difficult or almost prohibited under current Oklahoma law. That's why we've got to have the state question change. And when you look at what optometry is, there are 2 big factors to consider. One is quality of service, one is pricing and eyewear, and everything that goes around it, just like the glasses you mentioned you had just gotten. Under 793, nothing will change in terms of the quality of eye care that's being provided. There's nothing in there that in fact, all of the members of the coalition, whether it's Walmart or Costco, my company, or any of the companies, are committed to providing the same full service, comprehensive exam that all Oklahomans are doing right now. We already do it, in fact. Walmart does it in 47 states that they are. This year, my company is going to do about 23,000 full-service exams that are done by licensed optometrists that come from very good schools. That's what will happen here. So on the one side, you've got the quality of the exam, which is very important because eye care is just about that. It's not just about making you see better. It's about eye health and making sure if you've got a disease that it's treated, make sure you don't develop a disease. The other side is the pricing that Josh alluded to. And the survey we did showed that, frankly, Oklahomans are paying on average more than 15% than the surrounding states. It's a pretty comprehensive study. I think we've mailed out to you and others that show that. I think, from my standpoint, something that's even more important is that in all of those markets, children's eyewear was 30% higher than it is in the surrounding states. So children who desperately need it to see, to get a good education, people are having to pay more for that. Competition will allow prices to become more affordable. There are arguments out there that would say, well, this is just about cheap glasses. It's not about cheap glasses. It's about less expensive glasses for the very same thing. We compared apples to apples. We looked at brand X of child's glasses in Stillwater or Tulsa or Lawton, and brand X in 3 surrounding states. And in all cases, they were 30% or more higher. And so children are being penalized by this law too.
Yeah. This is it's as you said, it's an eyeglass issue. It's a retail issue. There's a lot at play here, a consumer issue. Who are your big financial backers in supporting getting this passed?
Yeah, so I mean, I can talk about the campaign. So in terms of finances, we've had support from some of the large retailers in which you've seen. We've had individual contributions. I mean, in terms of kind of long term, or not long term, I guess we're 2 weeks away now. So in terms of the final 2 weeks of the campaign, we'll have the resources necessary in order to run a competitive campaign. I mean, we'll take resources. We're raising money, as much as we can. But as you have articulated, this issue is an issue that not a lot of people think about. Because they think it already exists, maybe, or maybe this is something that is just a little too nuanced. And so, a lot with our coalition, what we're trying to do is we're trying to not only in terms of the financial backing, but we have partners like the Silver-Haired Legislature. So the Silver-Haired Legislature Senior Advocacy Group, they've endorsed 793. They've worked with Tim. They've worked with a lot of people in the past in order to try to get this law changed from a legislative side. During several sessions, and it just hasn't. We've been stymied by the by a special interest group.
Any other thoughts? Last second thoughts here?
Yeah, I mean, I think one of the things in which, we talked about the campaign, but one of the things, if this was truly about healthcare, and this was truly about consumer choice, and this was truly about access, then why wouldn't you vote yes for this? I mean, there's a pretty simple case to be made here. Let's say you go to a traditional optometrist and you like that, then come November 7th, you can keep that. There's nothing, November 7th, knock on wood that this passes, there's nothing taking that away. I think what is happening is that we want to give people the choice in order to go to a retail store to get their needs in terms of optometry and eyewear and eye care. That's it. So we're not telling people to change a behavior, we're adding something to the market in which they can take advantage to.
Selina, would you care to give us a brief understanding of what this state question is and what it means to you as an optometrist?
Sure. So thank you for having me, David. So state question 793, what that could look like for Oklahomans and with the language that's written into the state question. So I'll give you a real life example of what that could look like. The way that I currently see patients, and I'll just use a patient example, real patient, I just won't use her name. So she comes in for an eye exam to get new glasses because her vision's blurry. So we go through 10 elements of a comprehensive eye exam, which is what we have to follow in the state statute to constitute a comprehensive exam the way the law is written currently. So during those steps and all of those things that we do in that exam, we discovered that not only did she need glasses, but she also had a condition where she had a lot of fluid on her optic nerves. And when we discovered that, we did more testing. And when that happened, we sent her for an MRI, and she wound up having, thankfully, not a brain tumor, but that's what it could have been. She had a disease where she was just making too much fluid, and that was caught during her comprehensive eye exam. So the way this law is written, and the last two sentences are key to this, and this is why we're a vote no, and why I'm a vote no on state question 793, is because of the last two sentences written in the state question. And it says the corporation may limit the scope of practice of the doctor, and then the very last sentence says all other laws are void. So what that means in that scenario that I just gave you is the corporation could not do those full 10 elements to discover what she wound up having. If she had just come in for, I just want new eyeglasses, and we don't do all of those steps that currently optometric physicians have to follow, we could have missed that. And she could have gone blind. If it had been a brain tumor, she might have lost her life. So that's why I'm a no on this question. It's because of those last two sentences. The way that the statute is currently set, there's a board of examiners that regulates the profession. And if this were to pass, that regulation and that board is void because of that last sentence in the state question.
Okay, so it sounds like from your stance, it's not an issue of where these optometrists and where this eye care facilities are located physically, you're contending that this could damage the health care provided in those settings.
Exactly, that's correct. So it's not about where the care is delivered, it's those last two sentences that are so different, and we would be the only state in the country to have that kind of language in our state constitution. And so this is about the health care that would be provided to Oklahomans. We would have a corporation that would be between patients and the physician.
If this state question had come out without those last two sentences, would your feelings have changed on this?
No, and that's why it's so odd, is because if they wanted to practice like the other 47 states, and Arkansas is a good example because it's a two-door state, so it's similar to our state, they could absolutely do what they want to do with physicians and practice and sell glasses and do exams exactly as the law is currently written. So that's why this one is so different, and that's why we're saying no to those last two sentences, because if they really truly wanted to put a doctor in and have glasses, they could do that today without that language.
Why is that? That's something I was curious about. I've heard people say that, optometrists say that. What do you mean they could put it in today?
So if they wanted to have a doctor in a retail setting today, they could absolutely do that and still sell glasses and sell contact lenses and do comprehensive exams, and they would have to follow the same rules that the rest of us follow as far as the Board of Examiners being able to manage the profession and follow the profession. What's different about this is because if this passes, now you have no regulatory board to manage the doctors and what's happening with patient care. So that's the real fine print, if you will. Those last two sentences are why this is so different.
Okay. I want to ask you, who, along with you, who else opposes this? I know that there are a lot of optometrists.
Sure.
Is that kind of the leading driving force behind the
So
opposition?
there's actually other healthcare professionals that have come out because they recognize why this is different and what this could mean just across the healthcare profession. And so the American Osteopaths have come out and said no to this, as well as the American Psychiatric Association. And so other people are recognizing this, and then if you look across at other states that look at, and I've had conversations one-on-one with other optometrists in different states that already have retail settings, and they even recognize, oh, this is different.
What about the competition aspect of it, having an added
Sure.
retailers to the market? That's a kind of economics 101, driving prices down, that sort of thing. Could that damage your business?
So when you look at it, my patients already have lots of options. So like, for example, if I wrote a prescription today, I looked before I came, actually, I was like, let's just see what's online. So you can get a pair of glasses, distance glasses with lenses today on Zenni Optical for $6.95, delivered to your doorstep. I don't know that you're gonna find anything cheaper or more accessible than that. So my patients have that option right now, as do all Oklahomans. They've got those options to be able to do that. That was a long-winded way of saying, no, I'm not concerned about that, because they've already got those options.
Mm-hmm. Stay with News OK and the Oklahoman for more information on the state questions and the upcoming elections.